But do you have any questions at this point before we get started?
No.
Okay, so we're going to get started. This will be a break between the consultation and the exam, all right? So for the exam, we're going to do range of motion first, and we'll start with you sitting right there. I'm going to have you bend different directions. When we do that, I want you to go as far as you're comfortable each direction. Don't push through it if you feel pain. I want to know where that point of restriction is. And the same thing with all the orthopedic tests we do. Let me know if there's any discomfort. All right?
Okay.
All right, relax right there. I'm going to move the camera and then we'll do the exam. They say never move a camera on the tripod. Yet another rule that I break. That looks good enough there. You know what? I'm going to back it up a little bit because I'm going to have you walk over to the doorway for one part of this. Okay. All right, we're going to start with you sitting right there. Look straight ahead. And your first task is going to be to tip your head down and look at the floor. Great. Tip your head back and look up over your head. And relax. Did either of those hurt at all?
No.
Good. Relax a minute. We'll catch up with a couple notes. Next, without twisting, tip your head to the right. And then the left, please. Did either of those hurt?
A little bit to the left.
Okay, interesting, because you were able to go farther left. It was a little more restricted going right. Twist your neck and look to the right, please. And then the left. And relax. Either of those hurt?
To the left.
Okay, and that was a little restricted. Actually, we want 85 degrees, and you had 45 and 40, which is both of them are restricted. So that means there's probably some misalignment here, preventing that from moving through its normal range of motion. Did you hear any noise, crunching, grinding, or other noise when you're moving your neck around?
No.
Good. All right, next, think low back and twist to the right. Any pain?
No.
While you're there, bend backward. Does that hurt?
A little.
Okay, where?
On my hip.
Okay, twist left for me. Any pain?
No.
Bend backward. Any pain?
No.
Great, relax a minute. Let me catch up with a couple notes here. Next, I want you to push your head forward into my hand. Push hard. Does that hurt anywhere?
No.
Good. When I lift here, does that hurt?
No.
Good. When I push down here, does that hurt?
No.
When I push here,
A little.
stretching or pinching?
Pinching.
Okay. How about when I push here?
No.
Good. Relax a minute. Let me catch up with a few notes again. Any dizziness in your recent history?
No.
Good. Extend your left leg straight out in front. Does that hurt back here at all?
No.
All right, try your right leg. Does that one hurt?
No.
All right. Next, I want you to walk over to the doorway, please. And come on back. And have a seat again. Next, I want you, this one's a little complicated, so work with me. I want you to take a deep breath and hold it. While you're holding it, I'm going to have you push or strain like you're trying to have a baby. It will all come back to you. Take a deep breath and hold it. Push and relax. That cause pain anywhere?
No.
How about tingling, numbness in your hands or fingers?
No.
How about tingling or numbness in your legs or feet?
No.
Okay. All right. Let me do one more thing over here and then we'll be done. I want you to tell me if I hit tender spots as I work down along the spine here.
Wednesday, the 16th at 5:45. Perfect. Thank you.
Anything?
No.
Felt a little tight over here. Was that sore at all?
No.
Okay. How about down through here? Anything here?
No.
Okay, right there?
Yeah.
A little bit of knot there. Anything here?
No.
All right, we are all set. They're going to come back in just a minute to take pictures, and then we'll talk again right after that. Would you like some water while you're waiting?
No thanks.
If you change your mind, there's bottles right there. You can help yourself.
All right.
All right, we'll be back in just a moment.